So welcome and over to you.
Thank you so much. And I'm really happy and glad to be a part of this lovely platform. Thank you, Salome ma'am. Thank you, Nazneen. And thank you, Dr. Geeta, for having me here today. As we can see in the slide, this typically defines the journey of a lady, which all of us would have witnessed a topsy-turvy, ride across, starting from, adolescence to, then getting married, then pregnancy, and then, menopause, and then hell lot of issues around that. So if we say that balancing this, joy ride would really be interesting if we dietitians are intervening at the right time with our patients. So I'll just give you a brief context of how we are going to have this presentation today. We'll start from the basics as to what are hormones, what are the different kinds of hormones in female health, what happens when they, are in abnormal conditions, and how would our lifestyle management impact it. So hormones, as we know, these are those chemical messengers that control most majorly the body functions like hunger, stress, mood, emotions to reproduction. And if we look at how they are balancing it, it's just like the spider handling the entire cobweb. So that intricate is the role of a hormone. Don't go by the complexity of this slide. These are typically most of the hormones which are produced in a female body. We will address each one of them individually at a later stage. What we need to know is stress hormones. Now, when we are driving, suddenly we have somebody coming in front of us and we just become red. We release a lot of stress hormone. That is the effect of the hypothalamus, pituitary, and adrenal hormone axis, which can be triggered by any stressor. It could be any unforeseen episode which has happened, any upsetting news, anything which we didn't expect came our way, and suddenly there is a adrenaline and cortisol release. To some extent, stress is good because it keeps us moving, but when it overpowers the other functions of the body, this can be concerning. Moving ahead, we can see different colors in the slide. So these are typically the hormones that are found in a female body. So if we go by, the nomenclature, some of them are the sexual hormones, some of them are the peptide-based hormones, some of them are amino acid hormones. If we look at them in a little detail, we would understand by the side where we can see all these are the various hormones which a female body would produce, starting from the pituitary gland hormones of prolactin, FSH, LH, coming to the organ specific hormones, vitamin D, which was earlier considered to be just a vitamin, but now has been considered to be a hormone. Then we have the adrenal gland producing cortisol, also producing adrenaline. Then we have some amount of testosterone, which is produced from the ovaries and the adrenal gland. We have estrogen, which is the main female hormone, which is produced by the ovaries. In conjugation, it works with progesterone. We have something called the serotonin, which is produced from our gut. We have insulin, which is produced from our pancreas. We have SHBG, which is produced from the liver. Then we have the thyroid hormone produced from the thyroid gland. And we have the melatonin gland produced by melatonin hormone produced by pineal gland. So this is entire list of hormones that a female body might have. Now, some of these hormones contribute more to our sense of well-being and balance. Let's look at more details. Now, looking at cortisol, this is the first fat-forming hormone which is released in our body between 6 to 8 a.m. And the whole idea to release this is the body is getting prepared to get up from the sleep, produce a little bit of sugar, sensitize the body to get into the activity mode. This is also produced in higher quantities in situations of stress. And the main action of this hormone is to regulate our blood sugars. So when we get up fasting for almost 8 hours after our dinner, the body tries to produce a little bit of sugar. So you would find that the sugars when tested at 5:30 would be lower compared to sugars when tested at 8 a.m. in the morning. So cortisol does the magic of releasing some sugar into the blood, understanding that we would not be able to eat something so early in the morning, but we would start our physical activity. It also looks at energy metabolism, immune function, blood pressure regulation, central nervous system action. Now, what typically happens in our body when we go on this joyride of cortisol? So as we can see in the picture depicted, this is one of those joyrides where, a balance is very, very important to enjoy the well-being. But when the cortisol levels are high, we would see that there is high blood pressure, high blood sugar or diabetes. There's a lot of water retention. There's difficulty in losing weight. There is reduced libido. There is digestive issues, there are anxiety and difficulty in sleeping. Whereas when we see a cortisol deficiency, this can also trigger due to certain medications that people are on, which they do not understand. So we have cortisol deficiency, which can lead to decreased ability to cope with things, chronic fatigue, muscle weakness, decreased libido, low blood sugars, cravings for high salt and sugar foods, lightheadedness, and signs of depression. Coming on to thyroid, I'll first tell you the functions and excess and deficiency of each, and then we will go on what really happens in each stage. So thyroid typically would be presented in 3 tests when we do in our body as a thyroid panel, which is TSH, T3, and T4. And the main function of this is to control our metabolism. Metabolism would be the way our body uses the energy. What happens when we have high thyroid and low thyroid? Hypothyroidism is a condition where people start experiencing low metabolism, hair fall, fatigue, and they start gaining weight. In hyperthyroidism, they become hyperactive, they have weight loss, and they'll be extremely thin and trying to put on weight but find it very difficult. Coming on to estrogen, the primary female hormone, which is produced from ovaries and adrenal glands and also the fat cells. It is presented in 3 forms in our body, which is estrone, estradiol, and estriol. Typically, if we look at each one of these, estrone is the potent form of estrogen, has strong association with breast cancer, is associated with production from the fat cells even after menopause. So we would find people who are obese or overweight or higher number of fat cells do have good amount of estrone even after menopause. Estradiol is the strongest and most abundant form. It builds bone density. It is associated with breast cancer if elevated, and most commonly prescribed estrogen when hormone therapy and other treatments are advised. Estriol, on the other hand, is a weaker form. It is protective against breast cancer. It is produced mainly by the placenta during pregnancy. It supports vaginal health. So main functions of estrogen would be breast development, endometrial development, female reproduction, libido, body fat distribution, vaginal health and lubrication, bone formation, skin and blood vessel health, cholesterol balance, and cardiovascular health. What happens when a female has deficiency of estrogen? So there is a state of imbalance between estrogen and its counterpart, progesterone, typically associated with menopause. And in such situations, female witness hot flashes, night sweats, heart palpitations, insomnia, low libido, thinning of hair, decreased skin tone, urinary incontinence, foggy thinking, brain fog kind of a thing, yeast infections, dry skin, brittle bones, and depression and anxiety. When we have estrogen dominance, we typically find that there is again an imbalance between estrogen and progesterone, which may reflect in high estrogen or low progesterone. And here typically we find that the symptoms would be breast tenderness, fibrocystic breasts, lumpy breasts. Then you would see fatigue, irritability, bloating, sugar craving, heavy or irregular cycles of menstrual periods, spotting between the periods, significant PMS symptoms, hair loss on the scalp, headache, and weight gain. Coming on to progesterone, this is known to be the female hormone balancer produced by ovaries and adrenal glands, is responsible to regulate the menstrual cycle, sustain pregnancy, precursor for many other hormones, promotes energy production, burns fat, builds bone, and is a very important anti-anxiety hormone. What happens when we have deficiency? Progesterone deficiency is one of the number one hormonal imbalance when we look at women between 30 to 50 years of age. And this produces a lot of anxiety, bloating, menstrual cramps, bleeding between the periods, difficulty achieving orgasm, fatigue, endometriosis, irregular cycles, hair loss, hot flashes, inflammation and pain, insomnia, mood swings. So typically all the symptoms of estrogen prominence would be seen in progesterone deficiency. And when we see excess, we would find that the individual witnesses acne, swelling in the breasts, depression, difficulty losing weight, daytime sleepiness, facial hair, fatigue, sugar cravings, nausea, nipple tenderness, and yeast infections. We also have some amount of testosterone, which is even produced after the menopause. The main functions would be enhancing mood, improving memory, strength and muscle mass, decreasing body fat, protecting against heart diseases, and preventing osteoporosis. So some amount of testosterone, which is optimal level, helps us in maintaining good muscle mass in our health. When we have low testosterone, we would experience similar signs of menopause, which are hot flashes, night sweats. In addition, we also see arthritis because the muscle mass and the bone health is at stake. There would be high cholesterol, painful joints, depression and anxiety, low energy, loss of muscle mass, memory loss, thinning of skin. Very thin and wrinkly skin is what we would witness, weight gain, vaginal dryness. On the contrary, a high testosterone leads to weight gain, and it's like a muffin kind of a top where we see more of apple shaped obesity, where legs are thin, but overall we find the top of the individual bulky. There's acne and oily skin, there's depression and anxiety, there's difficulty in falling asleep, excessive energy, hair growth on the chin and the upper lip, sorry. Male pattern of hair loss like alopecia pattern is quite typical of how a man would typically lose his hair. PCOS and sugar and salt cravings. Other hormones which need a specific mention are leptin, ghrelin, insulin, growth hormone, and DHEA because these are responsible for overall hormonal imbalance, overall weight management, and our activity patterns. Now, leptin is basically produced in the fundus part of the stomach, which is basically meant for appetite surprising, and it's called the satiating hormone. Ghrelin is contrary to that. It is produced in the stomach. It is the hunger hormone. So leptin and ghrelin, if they are balanced together, we would have correct time of our appetite and portions. Looking at insulin, the blood sugar stabilizing hormone, which gets sugar into the cells when it is needed. We are all aware of it. Then we have the growth hormone, which is required for tissue repair, muscle growth, bone density. Highest production would be before 25 years of age. DHEA is most abundant hormone in the body. It's a precursor for other hormones. What typically happens age-wise when we have an imbalance? So when a lady is in her teens, you would typically find a rise from a low production of progesterone to erratic estrogen levels. And if the lifestyle is complementary, like healthy eating, wholesome eating with good protein, good physical activity, good sleep, you would find the whole cycle to be well balanced and you would not find any complications. But what we are witnessing these days is the entire lifestyle, sleeping pattern, hydration levels, stress levels, everything, physical activity, everything has gone for a toss. And post COVID, we are finding it very difficult to get this age group into a balance. And we are witnessing so many more patients in our OPDs coming back with bad acne, PCOS, endometriosis, weight gain, irregular cycles, bad menstrual cramps, and PMS related bad mood swings. When the same female reaches her 20s, we would find she's at her reproductive peak. Issues of hormone imbalance are still common, but lifestyle can really counter all these imbalances. If it is not taken care of, we would witness the problems to be continuing. And in addition, we would find that such people may even develop hypothyroidism, in addition to the hair growth and managing their stress. In the 30s, we find lower progesterone levels, higher stress, increased xenoestrogen exposures. I'll come and explain that a little later. This is typically the age where a mother is trying to settle down with her career or her family responsibilities and her children. So the stress levels are typically very different, and it could be a very demanding age where we find a lot of fluctuations in their hormone levels. We may witness worsening of the condition if there is PCOS, bad PMS, which may have continued from their teens and 20s and now landed them up in bad 30s. Hypothyroidism, endometriosis, fibroids, heavy cycles, painful periods, and weight gain. And most significant age for hormone imbalances around 40. 40 is when most of the females are witnessing highest incidence of hormonal imbalance. There could be sudden eruptions of acne, infertility at this stage, PMS, PCOS, fibroids, painful periods, bad hair fall, facial hair, and perimenopausal symptoms. When the same female reaches her 50s, she would see menopausal transition leading to fluctuations in progesterone levels. So all the low progesterone symptoms that we had seen would be clearly witnessed in this age group. There's a declining testosterone, so all the protective effect of the muscle mass, bone health would also go down. Fat percentage in the body composition will start increasing if the decline of testosterone is rapid. And there would be a fluctuation in the estrogen level. The average age of menopause in India has been considered to be between 50 to 52, and the symptoms may last from 46 to 56. So it may range from 7 to 10 years. Varies from person to person. Different people would witness any one of these symptoms, could be ranging from hot flashes to night sweats to weight gain to depression to insomnia to vaginal dryness and hypothyroidism. So this continues in their 60s, and this can contribute to a poor quality of aging and can contribute to some extent of mortality. So what are we supposed to do? We should not be concluding without testing the hormone, without correlating it with the age group, and ensuring that at each stage of life, there is a good amount of balance which can be maintained. Now, when we go for hormone tests, it's so very varied that depending on the time of the day you've given the sample, what kind of sample you've given, the time of the month, a lot of factors influence the laboratory values. So if you look at what are the typical samples that are collected, you can give a blood sample to test your thyroid hormones, FSH, LH, insulin, glucose, HCG, prolactin, and vitamin D. Again, the fluctuations really vary with whether it's a fasting sample or it's taken between 10 a.m. to 12 a.m. or it's an evening sample. So the values can really fluctuate. In case of urine sample also, we would find that the best urine sample would typically be best for a hormone and metabolite testing. It provides information on detoxification and metabolism of hormones. 24-hour urine does not show circadian rhythm changes. So again, if there has been a sudden sleep pattern change or, we would not be able to pick up those kind of changes in a urine sample. When we look at saliva sample, a lot of these kits are available these days where they home collect the saliva sample. But again, at what time the saliva sample was collected, when was it processed, a lot of things depend on that. And the outcome may vary. The best tests on a saliva sample would be for estrogen, testosterone, DHEA, DHT, cortisol, and progesterone. Going forward, if we look at now, this is typically how we would find the ranges, and we are all not trained to read these kind of reports. So one of our gynecologist friends can help us in interpreting these reports, and then we could correlate. But having a little background of how each hormone's excess, prominence, and deficiency can alter the symptoms, we can actually balance out a lot of things in our diet planning. These are again some of the reports where they have shown fluctuations in the activity patterns on when and how the sample was taken. You can see in the graph at the bottom how adrenal function graph can vary depending on the time at which the sample has been collected. So if I do a cortisol test on a sample at 5:30, my readings would be very close to low cortisol levels. But if I do it in the morning between 6 to 8 a.m., I would find totally different reading in the sample given. These are some of these interpretations of few of these reports. Now, how do we really strike out that balance or bring about a hormone harmony? So we would talk a little bit about typically what are the symptoms that they would witness, and then we would move on to the modifications. So we are aware that there would be a clammy feeling, there would be night sweats, cold flashes, bouts of rapid heartbeat, irritability, mood swings, sudden tears. You'll find people just breaking down for no reason, trouble sleeping at night with or without night sweats. There are shorter and lighter periods and followed by heavier periods of bleeding, flooding, phantom periods, shorter cycles, crashing fatigue, anxiety, feeling ill at ease, feeling of dread, apprehension, and doom. And this is very, very common. Now, if not addressed, it can lead to another big problem, which is of dental health issues. Now, estrogen receptors, as we all know, are also important for oral mucosal, similar to vaginal mucosa. And natural menopause is defined as a spontaneous cessation of natural menstruation. Many people undergo a hysterectomy due to excessive bleedings or fibroids or whatever, but they don't pay attention to the oral health around it, which can be the reason of paucity of saliva, increased dental caries. So, a special attention has to be given at that stage of life. We also see a lot of oral lichen planus, which is lesions in the oral cavity, and it can really get worse. It can go down to the pharyngeal cavity and then worsen the condition. Taste alterations, atrophic gingivitis, and rather than just treating it in isolation, one needs to understand that when we have a perimenopausal women coming to us, awareness and education around these points are also given. These are the ages when they may even go for prosthetics or dental implants. So what kind of precautions have to be taken, or what kind of maintenance has to be done? Moving forward, now the next would be our oral manifestations. So effect on the oral cavity, periodontitis. There could be candidus growing, there could be localized osteitis, there could be burning mouth, there could be trigeminal nerve involvement, and a lot of these things which could have delayed healing. So these are few things that we need to sensitize them on, because this can alter their food intake, and what they're comfortable eating is loads and loads of ice creams or sweet and cold items, which could then aggravate to another imbalance of hormones and bring about a weight gain bout. In perimenopausal women, we would find that this is the time when the symptoms would start. It may last from 1 to 3 years depending on case to case. There is increased PMS, irregular cycles, and here if you test the lady, you would find the LH and the FSH will be elevated. So if somebody comes to you and says that I have irregular cycles or I have these, just getting a serum FSH done in a morning sample would give you a fair idea on how closer she is to her menopause. Ovaries would respond with periodic bursts of hot flushes. Going forward to hot flashes, we find that 80% of the women have it at least once a month. There is surge of power, heat, and energy being released, so they need to be heard out. There would be fluctuations, there would be changes in mood swings, and this can be exacerbated if there is low progesterone level. This is the point where they have to be sensitized to focus all the energy into strength training, into good protein intake, so that they can then strengthen their muscles and lower the impact of low progesterone levels. Again, looking at the progesterone levels, they may decline due to lack of ovulation, increase in frequency through the 40s, and too much of estrogen relative to progesterone can also lead to estrogen dominance. And the typical symptoms, what we saw, would be visible. Common symptoms would be, if they are not checked or not monitored or not guided correctly, this could lead to fibrocystic breasts. There could be different tumors, there could be tenderness in the breast, mood swings, menstrual cycle. So this is the age where, that is why after 40, doing a mammogram is something which is really recommended for women. For women who are doing mammogram, if they're doing a radiological mammogram, it should be followed by a sonographic mammogram every alternate year, so that we don't miss out any of the clinical findings. Menopause typically would, so the whole cycle may take 5 to 10 years. So this begins from 1 year after the last period. And there again, checking on our patients for their thyroid levels and adrenal levels would be a good idea, because if they are low, then it could further worsen their symptoms. We also see something called a burning mouth syndrome, 43% in peri and menopausal women and 6% in premenopausal women. So typically, if you look at it, there is a lot of oral health involved. And why are we so much emphasizing on this? Because the entry point of the food is the oral cavity. And if there is anything which they are not able to comfortably chew, like your nuts or fruits, the peel of the apple can irritate their gums. So, they would switch on to a simpler and easier formula of having smoothies or fruit juices or things which can further, worsen their oral problems. So this is something which needs to be discussed with them, and texture modification here at this stage would be beneficial rather than nutrient modification. We don't want them to be on cold and sweet food items like ice cream. If you have a psychologist in your clinic or in your hospital, a psychological assessment will further help in strengthening your diagnosis and counseling to the patient. Now, in terms of the periodontal health, estrogen receptors are given. Sometimes there are, these corticosteroid gels which are used just to make sure that the infection can be kept at the minimum. Three more slides on the glands and the hormones, and then we move on to the management. So adrenal glands have two glands located on the top of each kidney. Cortisol is the main stress hormone, and sex hormones are also made here, which are our DHEA, testosterone, estrogen, and progesterone. As we age, the ovaries make less of estrogen and progesterone, and adrenaline picks up the slack. Healthier the adrenaline, easier is the transition to menopause. Acute stress conditions, like it could be an infection in the body, it could be an accident, it could be any trauma, it would suddenly lead to a release of high cortisol. Sustenance of that high cortisol depends on how good or bad the person's situation handling capacity is. Initially, we find the DHEA is elevated, and eventually we find increase in testosterone, estrogen, which then decreases because all raw material is being diverted to make cortisol. Cortisol in acute conditions has to be monitored because we know that it will trigger high blood pressure, high sugar, and this is the time when people may be having some comorbid conditions and it can really worsen a condition. Looking at chronic high cortisol, you would find them to be very badly controlled diabetics. Blaming it all on just exercise and diet may not be sufficient. Looking at a little bit of hormone history and trying to correlate and balancing it out would help. Abdominal obesity is typically seen in them. There's a lot of fluid retention, there's hypertension, there's breakdown of structural proteins. So we find them to be very sarcopenic and vulnerable to any kind of accidents. So this is the stage where we have to look at good home-based strength training exercises where they're not working out on a lot of equipments. We find suddenly, because they have time, the children have gone out for studies, so they start hitting the gym, they start doing a lot of weights without proper training, and they come back with very bad, listhesis of the spine or injuries of the cartilages, etc. So here, a good physical trainer can guide them on coming out of the sarcopenic obesity condition. Impairing their immune system, looking at the balancing act of giving our good immune boosters would be ideal. Going further, this is again something similar to chronic, stress, which could lead to low cortisol. So we find saliva testing as a very good sample to do these and estimate the levels. Less progesterone and less estrogen, this will worsen the symptoms of peri and menopause. They would be all the time fatigued, hair fall, joint pain and inflammation, allergies and autoimmune disorders. Treatment of menopause are multimodal. So right from, different kinds of yogas, we have specially dedicated bodies which are taking care of it. For a dietitian, it's very important to look at their isoflavones, to look at the natural foods which can give them wholesome nutrition. At the same time, a good strength training so that we could combat a lot of this sarcopenic activity. Something as simple as sitting on the chair and oscillating your hands for a count of 10, 3 times a day, and maybe do it 10 times a day while they're watching TV or doing something simple, while even boiling milk in the kitchen. If something like this can be done, it's a good strength training for the muscle. Or just resting your feet against the wall and lying straight on the bed. That also helps to strengthen the abdominal muscles and release a lot of tension from the varicose veins. People are put on different kinds of therapies. Now, when they are put on hormone replacement therapies, bioidentical therapies are definitely better than the completely chemical therapies. And here, this is what is typically done. Among the lifestyle factors, we are definitely looking at giving them a wholesome plan where they can restrict the calories from empty nutrients like sugar or excess amount of fat, but avoid skipping meals. This would typically be the group which is wanting to go for intermittent fasting or gymming, or go in for any of those quacks which will promise them quick, sudden results. Now, this is not the weight they've gained overnight. So this needs to be handled correctly. Otherwise, sarcopenia can worsen and the health and the quality of life can be really bad. Stress management through good physical activity and emotional management. A good sleep is very, very important to regulate the cortisol release at 6 to 8 a.m. in the morning. So if you're able to give them the good biological time sleep, first is awareness. So most of them hit the bed, but they're on their phones or their gadgets and all the time constantly checking on their messages as if some emergency is going to crash. So we need to tell them that they need to charge. Similarly, the phones need to charge and they need to have the good sleep in the biological hours, which is 10 to 6, 10 p.m. to 6 a.m. How much exercise would be correct has to be assessed by a personal trainer, and on precession, this has to be taken care of. This is also the age where women start indulging into a lot of caffeine, alcohol, different kinds of drugs, environmental factors, targeted supplementation. So these need to be carefully monitored. Looking at herb supplementation. Now, the whole market is flooded with a lot of glutathione, to improve your skin texture, to improve the skin color, to use it as an anti-aging, boost your metabolism, but nothing has ever been mentioned about the impact of glutathione on the metabolism. So one has to be very careful in, prescribing these OTC products or allowing their patients to take these, and also take a feedback from them. What is it that new you've started? Have you started on any kind of multivitamins or any imported supplements or any of those over the counter drugs? So that needs to be understood and explained to them how this can have an interaction. L-tyrosine, however, is a good supplement to take because it is good to reduce depression and low energy, and it's very, very physiological. Similarly, our licorice roots, which is our muletti, which has been age-old, has been used in many, many different chronic conditions. This helps in reducing inflammatory conditions. So a simple licorice stick or a root can just be boiled in water, or you can powder it and use it, and you could drink the decoction or the brewed water throughout the day. So those are simple things which can be addressed, advised, rather than in the packaged capsules or tablets where you don't really know the efficacy and the dosage and the amount of the ingredient present in them. Mind-body balance is very, very important. We have to look at good relaxation. Breathing has to be correct. There has to be autogenesis and biofeedback, exercise, diet, and self-hypnosis. Typically, you would find the husbands accompany the wives and they say she just doesn't do anything throughout the day. She's just putting on weight. Her main problem is weight. If she loses weight, she'll be fine. I would like to tell them that why don't you mind your own business? Because there may be multiple other issues. You really don't know what is going on. And just by looking at outside of a woman, you can't really say that she is undergoing only obesity related issues. Vitamin D plays a very important role. So getting them checked for vitamin D, this is a very complex diagram, and this shows how vitamin D has such an important complex role in our body. So getting it corrected would give us a lot of advantage in their health condition. Looking at bone health building and muscle strengthening through simple exercises can be done in conjugation with ensuring the estrogen, testosterone, all these levels are good. Calcitonin is taken care of, exercise, sunlight, and few of the other ailments, a few of the other micronutrients, especially
So
magnesium.
RDP के stickers and triangle page start जो आज का टास्क मैंने लिखा है.
So magnesium is very important for not just gut lining, but to reduce the muscle cramps as well. So our approach has to be going for natural foods, if not completely plant-based diet, having it in the purest form, ensuring enough protein in every meal. So if something close to 20 grams of protein can be looked at in every meal, we hit the target there. Be regular with the exercise. Sustenance is the key to exercise, not hitting the gym twice a week for 2 hours. Coming closer to a healthy body composition rather than a healthy body weight. So we have to make sure that we just don't target weight, we look at a good body composition. So a simple example of when we look at a horse vis-a-vis a buffalo, who do you think is fatter? So all of us think that weight-wise, maybe a buffalo would be fatter. But if you put them on the weighing scales, a buffalo is around 350 kgs, whereas a horse is 800 kilos. So we can appreciate the beauty in the shape, not in the weight. So they have to have a good body composition rather than just boggling down on weight. Education on limiting the exposure of endocrine disrupting chemicals abundant in our kitchen, right from aluminium foils to non-stick cookware to plastics to a lot of those Swiggy packed containers. So one has to really abstain from using all these items. Age-related recommendations, if we look at, these are different ages. 30 is the time when people are getting into their jobs and they really want to snack on unhealthy items. So a little education there. Mindful eating because they are into the habit formation for their children. Cutting down on unhealthy, high calorie stuff and ensuring that we get into the habit of drinking a glass of water before at least 15-20 minutes of the meal. Studies have shown that this can reduce 62 calories intake in every meal. When you reach your 40s, metabolism is slowing down at a rate of 4%. So you need to make sure you make those adjustments by reducing your calories. So if your intake has to be 1800, if you're really one of those lucky females who can eat 1800 calories, you need to bring it down just because you've turned 40 by around 180 calories. Choosing and making smart choices would be a good idea. Again, when we are moving towards our 50s, we have to further reduce 75 calories per meal to ensure that we maintain our body weight, switch to healthier options and good snacking options. In the nutshell, if we look at it, eat healthy, start your day with good breakfast, whole grains, low-fat dairy, include healthy snacks, snack on options like nuts or yogurt or, natural things rather than packaged food items. Balance is very important, reading labels, moderation, and exercise. Keep moving, ensure that exercise becomes a part and parcel of our life. It could be in any form, biking to work, cycling to work, jogging, swimming, dancing, household work, staircase, whatever works best for you. Any movement is activity, but it should be done throughout the day, not 6,000 footsteps in the morning and then we sit like a log the whole day. So we have to make sure we are active throughout the day. In our foods, we look at local, fresh, and seasonal fruits. We vary our vegetables. We look at calcium-rich foods. We look at least 50% of our grains to be whole grains. If they are from millets, nothing like it. And we go leaner on proteins and limit our fat, salt, and sugar. We also choose to ensure that we know our food. So we could opt for healthy cooking options, involve our boys at home, so that we're able to make healthy, interesting family bonding activities with healthy eating. Exercise and a regular health check would be very important here. Make drinking water interesting in different forms. whatever works best for you. So you could choose one of these different forms. You could switch to healthier vegetables, more variety of vegetables. You could look at quick, healthy, wholesome meals or drinks which give you satiety but are healthier snacks and not giving you a lot of calories. So you could use any of those methods, be it the My Plate method or the USFDA food guide pyramid, but make sure that you stick to a plan and you every meal is an opportunity to fight the disease or feed the disease. So it's very important that we take time for ourselves and counsel the same to all our patients to go for regular health checks and monitor their daily intake, sleep, hydration, and food intake. So I think with that, I would conclude the technical session. I'm really sorry the slides were too many, but the topic was so vast that I couldn't do justice to such a vast topic by minimizing the slides.
Thank you, Priyanka. That was a fabulous session. We thoroughly enjoyed. You've actually covered the entire presentation in so much depth, which is excellent. In fact, it was a lot. It is absolutely relatable because you are in the age and you're going through a whole lot of stuff. So I think everybody in the audience has loved the talk, and it was very very good. In fact, you covered so many smaller nuances of the entire session also. And the periodontal session was very unique. I don't think many people really look at a connection of both of these. So I think that was also very, very interesting grid that you covered. Salome ma'am, any comments?
Details and
Hello? Ma'am, you're muted.
Okay, excellent session, Priyanka. Thank you so much. I think you have covered almost what we wanted to listen. And I think all the participants have received what they want to know or should learn about hormones and how to manage them at different stages of life. That's very important how you segregated them age-wise, 30, 40, and plus 50, because that's how we need to look at. And yes, definitely more than body weight, the body composition, we need to look with connection to the different hormones. And yes, the management is basically the lifestyle management, and whatever treatment you are taking from your gynecologist or anything for elevated FSH, LH. Mostly, unless it is very critically elevated, treatments are not given any HRT or other things, but I think it's manageable with isoflavones and other dietary management or supplements. So I think that part is also very clear. So thank you so much. Do we have any question, Nazneen, on the chat?
No, Richa, you have a question? We have a lot of wow
Good evening,
comments for you.
everyone. No.
Yeah.
It is not a question, but it is just the appreciation of the presentation. It was very well comprehended and very well put up, and all the points which were related to menopause and all the age groups, starting from 30s till 50s. And like you said, she's covered a whole spectrum of menopause. So very well comprehended. I just want to congratulate Priyanka. Thank you, Priyanka.
And I love the entire synon that you did with the roller coaster ride. I think it was absolutely relatable. I think it was very very well conceived. It just made the entire learning so much more fun and relatable. So, uh, yeah. And I think also the section on, especially the nutraceuticals and over-the-counter drugs, I think people really are going overboard. So, would anybody want to share your experience, Priyanka? Would you like to elaborate a little more
Yeah,
on
Priyanka,
that?
you in your practice prescribing any herbal or any other supplements for these groups, or hormonal changes, then we would like to know from you.
Correct.
Ma'am, I was talking about the OTC supplements of especially glutathione,
Yes.
collagen, where people don't really know what is the dosage that they're supposed to take. And
Exactly.
I have a patient who is a diabetic but very well controlled, lean and thin. But just to look at anti-aging, she started glutathione at 500 milligrams per day. And over 2 to 3 weeks, she had very bad palpitations. The blood pressure was high. She wanted to sleep the whole day, and she could not figure out a reason for that. And when you look back and you see so many things indicating to each other and interfering with each other, because all of them come with combinations of different other vitamins and minerals added. Some of them we don't even know what nutrients do they carry. So it's very important to be careful on what you take. And I've always seen that taking a direct nutrient would not be so assimilable in the body compared to taking a one stage prior precursor.
Exactly.
If you take one stage prior precursor, say N-acetyl
Choline.
amino acid choline,
Yes.
rather than taking glutathione, you may have better results. So, the body assimilates it better, it's able to justify, and the excess is not found.
Exactly. I mean, there's a lot of hype for glutathione, and people forget that it's synthesized in the body. And when you have the right peptides and take the acetylserine and lysine, so I think we should educate this group of women that there is no need of these supplements, whether it's skin or whether it's hormone. I think there is no need. Do
Also,
we
one
data on glutathione synthesis being reduced according to the age?
It could be, ma'am, yes, it has found, but people are taking not because of the metabolic pathway, they are more taking it for the color correction and anti-aging.
Yes.
And that way you would find coenzyme Q10 and your
quercetin.
NMN, those give you much better results compared to what glutathione will. But it's just a marketing gimmick, and people are
Ex-
falling for it.
Also,
Exactly.
also today, I have one question. So today, a lot of women, especially, are kind of heading on with melatonin, especially because sleep. Like if you even in your presentation, right from like 35 to about the sleep is like in a topsy-turvy thing, and like at one point of time there is chronic fatigue syndrome, and people are now started buying a lot of melatonin over the counter. So your comments on that, and ma'am, then you can add. Priyanka, you can go first.
Not a great product again. We found a lot of studies, causing more harm than the benefit for melatonin. So first is to correct your sleep aversions, something has gone wrong. We're all in LED lights all the time. We're all sitting in the AC. We're not doing much physical activity. Our sleep cycles have delayed. So that correction has to come in first rather than popping in melatonin tablets. And we have one of the very leading psychiatrist from UK who's now practicing with us, and she says she's seeing more cases of depression, and that is some way related to the melatonin taken at earlier stages of life. So I don't think we should interrupt with the natural cycle of bodies functioning, but try and go back to our, age-old practices. We don't write any longer. And if we write, graphotherapy is another science which stimulates our brain so much, and we would not find people having Alzheimer's and Parkinson's. You take an example of priests or the Maulvis, they're all the time with their, beads doing this, and you wouldn't find them in the hospital coming back to you with Alzheimer's or Parkinson's. It's only those of us who are working on the system all the time, and we're sort of burnt out and we are not sensitizing our brain.
Exactly, exactly. I think you have really pinned it, because this is what we really need to educate. Apart from the graphical, even I have read the papers on singing. So if people who sing also, they will activate their brain, and which is not there after certain age. We don't see that even bathroom singing in our day-to-day life. So that is one thing. Melatonin now, I don't know why it is coming up, but do we know the dose of melatonin required? I really do not know. And that's why we should hold back and not prescribe or discourage using these supplements, at least for insomnia and even for your whatever they say for skin or what. I think there is no connection, and we really do not know how much do we need to take it, how much do our body is having naturally. I don't know. You have any idea, Priyanka?
Sorry, ma'am, please come again.
The melatonin requirement.
Dosage, no.
No.
So we do not know. It's just something natural, and I think it's not measured also. How much is synthesized and how much we need it for, say, 8 hours of regular sleep. It should be the normal phenomena. So
And our diet is giving
Over a
us
period of time, when
vitamin
you're
and
taking in a melatonin supplement, it starts also reducing your natural melatonin. So that's another challenge.
yes, that's correct.
Okay. Also, I think Priyanka, you very aptly mentioned about magnesium, and I think that is something which is a very, very powerful, supplement which one can have both in terms of pain management, and it also takes care of a lot of other issues as well. So your comments, and then ma'am, Richa, you can add more.
magnesium gives you a lot of calming effect in people who are hyper active and very stressed out. So rather than using an anti-anxiety pill, looking at magnesium correction would definitely give them good relief. We find it in the form of tablets, in the form of sprays, in the form of powders, in the form of oils. So those would be better rather than looking at anti-anxiety pills and all that.
Yes, I agree with you, Priyanka. And magnesium is, I mean, if I say that the soil itself has lost its savor, so we are not getting it in our whole grains as we should be getting it. The magnesium should be the richest in our grains, and which we are not getting. And the commonly we do not think about magnesium. It's an energy, factor, and how it will help our energy metabolism. So it's a definitely. I think we should give calcium. I generally give calcium with magnesium. Uh,
Magnesium.
Preferred for women because that does help, and only magnesium supplements people may not just take it. So if you are taking any supplement, say calcium or a vitamin D, you can have calcium, vitamin D and magnesium together, and that's going to take care of your cramps and so many other things. What a 50 plus or a 60 plus women will feel it. So I think that is good,
Definitely.
Nazdin, and I think
And
we should.
probably for hypertension or lifestyle disorders, and also ma'am
Yes,
in gut health.
yes.
Yes, magnesium supplements can be recommended. Yeah.
Sure. So I think we've covered all the questions. I think Chitrakshi also made a comment that magnesium D3 glycinate helps with sleep. So yes, I think all the speakers have already endorsed that. So thank you so much, Priyanka, for this lovely presentation. I think it was beautiful. You covered every bit of it in a very innovative way, and I think most of the people here could relate to the presentation completely. So on behalf of BNA Life, I'd like to say a big thank you to you. A big thank you to Salome ma'am for continuing this initiative. This is our 30th,
Episode. Yeah.
this is today, it's the 30th session, and I think we've come a long way. We've had some fantastic speakers like Priyanka over the past 3 years, and I think each month we do this session once a month. And we have a fantastic back-end team with supported by Richa Shukla, Dr. Geeta, the entire team of Nutritionists, Mr. Gandhi, Pius, Alpesh, Vishaka, and also what you all have to look for is the newly renovated website. This website is, now in almost done. It has all the links to the previous sessions. It also has a lot of, direct links which will take you on to a lot of international journals. So we are trying to create a resource library for all the dietitians so that you have everything at one click. We'll be having links to over 300 journals. It's in the making, so I think by the next week you should be able to kind of access that. Please look at the BNA YouTube live channels. Everything is all the previous talks are also uploaded there. So with that, thank you so much and have a great day. Thank you, Priyanka, again.
Thank you. Thank you, Priyanka, Nazneen, Richa, all
Thank
of
you,
you.
Priyanka. Thank you
But-
all.
Thank you, Mr.
Have a
Gandhi
good
and
evening.
team.
Thank you, Mr. Gandhi.
Thank you. Bye.